The following portion of Studio 512 is sponsored by BioBehavioral Research of Austin. BioBehavioral Research of Austin conducts clinical trials for adult and pediatric patients. Dr. Neha Reshamwala, owner of Frontier Allergy, Asthma, and Immunology, is here to talk about her work as a primary investigator at BBRA. Dr. Resh, so you're kind of representing two companies here today. Will you tell us a little bit more about them?
Yeah, sure. So I've been in private practice as the owner of Frontier Allergy, Asthma, and Immunology here in the Austin area, and I've been doing allergy, asthma, immunology work for the last 13 years.
Wow.
As a practitioner and provider, I've been very passionate about research and really staying on the forefront of medicine for our patients, and really want to be able to offer the patients the most up-to-date medical treatments and medications available.
Okay, all right. We'll talk a little bit more about that in just a moment. I do want to ask, what options are available out there right now for adolescents with asthma?
So currently what we have in place for rescue treatments for patients for their asthma is albuterol. And of course, patients are, what we call on maintenance medications. So they're on everyday medications, possibly for treating their asthma and controlling it. And that could be from anywhere, Symbicort, Pulmicort, Flovent, Advair, medicines that we might have heard or maybe familiar with out there in the daily, medical world. And then also, it's important that we want to be able to have these patients, really see if a medicine like the combination medicine of albuterol with budesonide would be impactful for controlling, their flare-ups of their symptoms when it happens, in comparison to what's already been out there for a while, which is albuterol.
Last question,
Sure.
really quickly.
Yeah.
If someone's watching today and they're thinking, oh, actually, my child has asthma, my adolescent has asthma, we're interested in learning if we could get some help here, what would you say to them?
Oh, that's perfect. Basically, if you are a parent or a caregiver for an adolescent between the ages of 12 and 17, and you feel like they are having exacerbations or flare-ups of their asthma, and they can definitely call BBRA or visit their website, and someone will be ready to answer any of their questions and actually determine if the adolescent is actually qualified to participate in the study. And then really based on that, they will be able to guide them in seeing, what other parameters need to be met for the study. And then they'll also be able to provide information about, how long the study goes on for, which is about 13 months, and also the number of visits.
We appreciate everything that you do, Doctor. Thank you so much.
Thank you.
Learn more at bbraustin.com. The preceding portion of Studio 512 was sponsored by BioBehavioral Research of Austin.